FUE versus PRP. What's the difference? First of all, FUE stands for follicular unit extraction, which is a surgical procedure. PRP stands for platelet-rich plasma, which is an injection. So in the former, the FUE we're extracting here, we're doing a transplantation. In the PRP, platelet-rich plasma, we're injecting growth factors to stimulate hair, even fine hair that the patient already has. These are vastly different procedures.
Right. One of the major difference is that PRP is more for protecting your pre-existing hair. If you don't have any follicles there, like empty spots, only option is the permanent solution of FUE transplant. I think that's the most major difference, I think. Mm-hmm. PRP works really well in the crown area if you have a lot of thinning hairs going on. But you still need to have the follicles there. If there's no follicles, whether you take medications or PRP injection, nothing's gonna grow. But long as you have hair follicles there, but if you have a lot of receding going on and hairs are really, really thinned out, I think the best option is doing PRP, the treatment. Because when it comes to the surgery, you cannot put new follicles on top of your pre-existing hair follicles. You need to have the empty spot where there's no follicles are there, and that's the area only for the surgery. However, if you still have a lot of follicles and like the hairs are really thinned out, I think the PRP is the best option. If there is no follicles, meaning follicles are already damaged and died, only option is the surgery and put new follicles there to fill out that empty spot to have the new hair grow.
So there's a significant cost difference between PRP and the actual surgical procedure, or FUE. So PRP costs about $550. Again, remember, it's an injection procedure spun down from centrifuging our blood or injecting the serum. You move that comparison to the actual surgical procedure, which is a surgical procedure of the transplantation. And depending on the number of follicles placed, the approximate cost is $6 per follicle. So to do some quick math, if a person needs 1,000 follicles, that would be about $6,000 for the surgical procedure compared to about $550 for the platelet-rich plasma. But again, realize that these are not apples and apple comparisons. One is both of them are specifically designed. One is if you still have active follicles present, even though they're small, to promote growth. The other one, you've lost the follicles. There is no way that PRP is indicated for that case because it won't work, and you need to do the transplantation.
So PRP has really, really short downtime. Like basically, even after 5 minutes, everything is normal again. If you need to wash your hair or like go out and play sports, you can do that. PRP is all coming out from your own body, and we are putting it back onto your scalp again. So there's no side effect, when it comes to PRP. Really, really safe and really short downtime. FUE, the downtime is about 2 weeks because the 2 weeks are really, really crucial because that's the time of hair follicle and the blood vessel making connection together. But after 2 weeks, you can resume your old activities again, playing any sports that you like. So the downtime for FUE is about 2 weeks. So PRP, we recommend 3 treatments initially. 1 treatment per 8 months. So after the 3rd treatment, which is at the end of the 3rd month, we still have to wait about 2 or 3 more months to see any improvement. And that's also the same as FUE. After the surgery, we have to wait about 5 months minimum to see any baby hair come out. And even after baby hair comes out, we have to wait about another 5 more months to see full hair growth.
Question comes up: what is the difference in pain, the actual procedure between the PRP and FUE? So let's face it, needles hurt. Okay, so the PRP hurts. We use a very small gauge needle. It's 30 gauge. Sometimes people will take an over-the-counter medicine beforehand. And it reminds me almost of women who pluck their eyebrows and so forth. It's going to hurt a little bit, but it's short-lived and people get through it without much of a problem. The FUE hurts initially because we have to anesthetize the scalp with local anesthesia. So the local anesthesia hurts, but after the local, which is 2-3 minutes after they're really numb, then the entire procedure of FUE is painless. They're numb and they're not feeling anything at all.